Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sana. Welcome back to my channel. Today we are going to discuss about one of the conditions that related to men, which they are ashamed to talk about. It's erectile dysfunction. Okay. Erectile dysfunction means a difficulty in getting or keeping an erection firm enough for sexual activity. It is very common and can affect men at any age, though it become more common with the aging. Let's look into what is normally happening. Okay. An erection occurs. An erection occurs when the brain sends sexual signals. Blood flows into the penis, and then what occurs is the muscles and blood vessels relax, and the penis become firm. This is what usually or normally should happen. In erectile dysfunction, when one or more parts of this process doesn't work properly. So let's look into types of erectile dysfunction. There are two types of erectile dysfunction: occasional erectile dysfunction and chronic erectile dysfunction. First, we look into occasional erectile dysfunction. It happens sometimes due to stress, tiredness, or anxiety. A very normal and usually not serious condition. Next is chronic erectile dysfunction. Happens frequently or consistently. Usually linked to some underlying medical conditions or psychological causes. Needs medical evaluation. Okay. Now let's look into common causes of erectile dysfunction. Physical causes are diabetes, high blood pressure, heart diseases, obesity, smoking, alcohol or drug abuse, some hormonal imbalance like low testosterone levels, certain medications, nerve damage or injury. Next is psychological causes. Okay. Performance stress, performance anxiety, depression, relationship problems, emotional stress. Often, erectile dysfunction is actually a mix of both the physical and psychological factors. Next, we look into the symptoms or how the erectile dysfunction is presented. Okay, they are trouble in getting an erection, trouble maintaining an erection, reduced sexual desire, softer erections than usual. Okay, so what are the risk factors? Okay, increasing age, chronic illness, especially diabetes, heart diseases, sedentary lifestyle, smoking or alcohol abuse, mental health struggles. These are risk factors in erectile dysfunction. Okay, so let's look into why erectile dysfunction should not be ignored. Sometimes erectile dysfunction is an early sign of heart diseases, blood circulation problems, hormonal disorders. So doctors often consider erectile dysfunction as a signal to check the overall health. Okay. Now let's come to the treatment options of erectile dysfunction. Treatment of erectile dysfunction mainly depends on causes. Along with the medications, the options for treatments are lifestyle changes, exercise, healthy diet, weight control, quit smoking, reduce alcohol, etc. are lifestyle changes that we can practice. Next comes to the psychological support, stress management, counseling or sex therapy. These are the psychological support usually in treatment options. The next is medications. Medications also prescribed by doctors used for erectile dysfunctions. Next is hormone therapy. If testosterone is low, hormone therapy also helps. Now let's come to a point how to know someone is having an erectile dysfunction. A man who may be experiencing erectile dysfunction if he regularly has one or more of these signs. The main signs are difficulty in getting erection, difficulty in keeping the erection until the intercourse finishes. Erections are weaker than before, loss of sexual confidence or avoidance of intimacy, sometimes reduced sexual desire. Okay. The key point is if it happens in once in a while, it is usually normal. If it happens frequently or repeatedly, it may be an erectile dysfunction. Okay. So let's look into what is meant by usually normal or when it is usually normal. Temporary erection problems can occur due to stress or tension, fatigue, relationship conflict, alcohol use, or anxiety about performance. These all may cause temporary problem in erection. Most men experiences this in some time of their life. Let's look into when you should seek a medical attention. Okay. Medical help is recommended if the problem happens repeatedly. Difficulty continues for several weeks to months, happens most of the time during sexual activity. Next point you should note is sudden change. The man have the previously normal erections but suddenly stops working. This can sometimes indicate medical or emotional causes. The next point is if you are associated with some other health symptoms like low sexual desire, pain during erection, curvature of the penis, urinary problems, fatigue, or low energy. So these signs you should consider and seek a medical attention. Next point is if there is an existing medical condition. A doctor visit is important if he has diabetes, heart conditions or heart diseases, high blood pressure, hormonal disorders, history of pelvic injury or surgery. Okay. Next point is emotional or relationship stress appears. If you feel anxiety about performance, depression, avoiding intimacy, relationship tension, erectile dysfunction can happen with both the physical and psychological issues. There is a simple method in which you can differentiate it as a psychological or physical erectile dysfunction. It is morning erection disappears. This is the main helpful medical clue. If natural morning erections are still present, the erectile dysfunction you are experiencing may be often psychological cause. If morning erections also disappears, then maybe the erectile dysfunction is due to physical causes. It's not always exact, but doctors use this as a clue. Next, I want you to remind us why the early checkup matters. Erectile dysfunction can sometimes be an early warning sign of heart diseases, blood circulation problems, diabetes, or hormonal imbalance. Sometimes erectile dysfunction shows up years before heart symptoms. So it is very important to check if you feel so. That's all about today's video. Let's stop today's topic over here and we'll meet in another session with a new topic. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.